Okay, good morning, everyone. We'll go ahead and get started with DPS Superintendent Susana Cordova. We can't hear you. We can see you, but we can't hear you.
Hey folks, can you hear me now?
Yes, we can. Let me just.
Sorry about that.
No, that's a problem. Okay, you're good.
Great. Well, thank you to everybody for joining us today. And we are really pleased to be able to introduce our special guest. Sorry about that. Joined with our special guest, Dr. Bill Berman from Denver Health, who can speak to us about the current health conditions for the city and county of Denver, and particularly how we are using the dashboard metrics that help us inform our decisions. We're monitoring that information really closely as we welcome back more students and staff into our schools and our buildings. Dr. Berman has been our expert voice and just an incredible partner to us as we continue to navigate the COVID crisis. He's done tremendous work to help us better understand the evolving health conditions in our city. And so we really want to thank you for joining us. Before I turn it over to Dr. Berman to give us an update on where we are as a community, I want to share a few DPS updates, and then we'll move over to that. So we're really excited to share the news that we have 2 teachers from the Denver Public Schools who are named finalists for the Colorado Teacher of the Year Award. Rachel Lamb, who is a 2nd grade teacher at Inspire Elementary School, and Gerardo Munoz, a secondary teacher at DCIS Baker. I'm particularly excited. Gerardo Munoz was the teacher for both of my children in middle school and high school, and so it's especially touching honor that he was named a finalist. And so to both Rachel and Gerardo, we're incredibly proud of your hard work. It's always such a great joy to recognize teachers and the work that they do to shape and mold the lives of our young children. So just incredibly grateful. When I was a student in DPS, I have very strong memories of the teachers who went above and beyond to make my learning experience particularly impactful, and have many, many teachers who went the extra mile to motivate me, to inspire me, and to teach me. And so I'm so proud of these 2 teachers who in many ways are representative of so many teachers in the Denver Public Schools. And so we're really excited to be able to share this celebration as they were named finalists, and would be thrilled to watch them through this process. Hopefully we'll cross our fingers that one of our DPS educators actually is awarded Teacher of the Year. Want to share with you an update about a virtual symposium that we have going on. We are continuing our focus on equity in DPS, and in particular, the African American Equity Task Force is driving a lot of the conversation about how we can collaborate with our community. Families, students, and DPS team members are invited to join a virtual family symposium on this coming Saturday, October 10th, from 9 a.m. to noon. This will be a welcoming space centered on the work of the Black Excellence Resolution that was passed by the Board of Education last year. The symposium will offer tools to support our community in navigating the school year with topics such as mindful healing, family engagement, and college and career exploration. We hope to spread the word to as many families as we can so that we can continue this important work together. And as I mentioned, Dr. Berman is here with us today, and we'll be sharing some insight into the current health conditions before we move on to the Q&A portion. So thank you for joining us, Dr. Berman, and I'll let you take it all over from here.
Thanks, Susana. I just wanted to make sure that everybody can hear me fairly well, because for me, the audio is a little distorted.
You sound clear.
Sounds okay?
Sounds great.
Great. I'm Dr. Bill Berman from Denver Health. I work in public health and am honored to help Denver Public Schools with the many issues around trying to reopen in-person K through 12 education. Over the last 3 weeks, there have been some concerning trends. We've put those on our website and on the Denver Public Schools website, and I'm sure you've seen those. We've had an increase in the daily number of cases in Denver from about 40 to about 95. That increase, fortunately, has leveled off and may be starting to go back down, although I think that's a little less clear. I think it clearly has leveled off. Initially, nearly all of that increase could be accounted for by some fairly substantial numbers of cases among college students at Denver colleges. But as happens elsewhere with transmission of COVID, it's very difficult to keep it all limited within one part of the population. And so we have evidence over the past week that this particular increase has become more broad than just among young persons going to college in Denver. There isn't a specific predilection for any specific part of the population. So we've seen increases in older adults. Fortunately, we've not seen significant increases in school-aged children, and I think that's important to note. So rates within school-aged children in Denver remain relatively low and stable. And so in part for that reason, we continue to think that the Denver Public Schools plan of carefully reopening in-person instruction in phases, starting with the youngest children, is a very good plan. So I'm happy to take any questions.
So as always, we'll do a question and answer. If you could pose your question in the chat box, let me know who you're directing your questions to. Okay, so our first question, Melanie at Chalkbeat asks, what have COVID test results looked like among DPS staff, and how many percentage have tested positive?
So thank you. We have partnered with Gary Community Investments to offer COVID Check Colorado to all DPS employees. So far, even while we've been mostly working remotely with our students, we do have staff who are in our buildings. I'm actually officing out of a school building, and we do have students who are beginning the process of returning. About 25% of our educators have participated in COVID Check. And right now, our positive rates are still in the 1% range of people who test positive. In some cases, those might be people who've tested through other, through their healthcare providers, for example, and have reported that to us. Our numbers are very, very low right now, and it certainly seems to mirror the trends that we're seeing in school districts that are open. And so we're monitoring that very closely so that we can make sure that our reopening is safe, that we do anticipate that there will be cases of COVID, but our goal is to very quickly be able to move people into isolation if they have COVID through their work with their primary healthcare doctors, and to do the quarantines that we may need to do in our schools immediately upon notification.
Thank you. And from Russell with Denver 7, is there a problem with staffing in some schools? Does DPS need more paras and more volunteers to meet the need of returning to in-person learning? And also, why did the return plans vary greatly from school to school?
Yeah, so thank you. And I think this has actually been one of the most challenging aspects of returning to in-person instruction. And so when you think about the schools that we have in the Denver Public Schools, we're really blessed to have incredibly unique school communities, school designs with lots of different involvement of our parents, our family members, our teachers, and our leaders. We have some high schools, for example, that serve 60 or 70 students. Our largest high school will, at East High School, is over 2,500 students. And so very different conditions in every school. As we've worked on our return to in-person planning, The different factors that we look at are the number of students who have selected in-person or virtual, the number of teachers in every school who are available to work in person. Many of our teachers have requested accommodations either based on their own personal health conditions or secondary considerations that we are working to support as much as possible. And so depending on the number of students, the number of teachers, the size of rooms is really helping us create the unique plans for each school community for a safe and supportive in-person return. And so it's obviously very different. We have some high schools, for example, where close to half of the students have selected virtual, the 100% virtual program. We have other high schools where 80% have selected the in-person program. So very different scenarios in terms of how to be able to do that. Some of our large high schools in particular have really grappled with high numbers of teachers and staff members with accommodations that have made it really challenging to be able to offer all coursework in person. But in all cases, any family that has selected the in-person instruction, we will have scheduled time for students in our buildings where they can receive supports that go along with their coursework that may be conducted virtually.
Thank you. And from Melody at Chalkbeat, this is for you, Dr. Berman. What are COVID rates and numbers for school-age children? What have the trends been, and what ages are considered school age? And we can't hear you. If you would unmute.
Okay, thank you.
Thank you.
You'd think I'd know all this after 7 months of a pandemic, but I don't. So let me start with the last part first. So we've looked at ages from 0 to 18. We've done that just so we can look at the early childhood, pre-K population on up through grade school, middle school, high school. And we've looked at those rates individually and over time. I don't have the numbers and rates in front of me. I can get those for you. What I can say is that in general, over the last 7 months, they not surprisingly follow the community rates, although lower than other parts of the community, and they've been relatively stable over the past month. So fairly low and stable. As in other places, the older the children and youth, rates are somewhat higher. So rates in high school students are roughly twice that of kids in grade school, and that reflects national data as well.
Thanks, Bill. And another question from Teeny at the Denver Post. Some schools have said that DPS cohorting restrictions have made in-person learning impossible. What are your thoughts on the specifics? For example, 35 students per cohort and teachers only interacting with 2 cohorts.
Yeah, this has been a subject of very active discussion among ourselves and with the district and with principals. The new guidance from state health allows for what's called targeted quarantine if schools can show that they're doing the basics of masking, distancing, hand washing, good ventilation, etc., and seating charts, importantly, seating charts. And so we've been discussing with DPS leadership that this may offer opportunities to look at different cohort sizes. So very much under active discussion. Susanna, do you want to add?
Thank you. And you know, one of the things that I think has been, you know, just part of how we have approached grappling with the conditions and the guidance has been to take a flexible position so that as new information comes out, either about rates of COVID in our community or new guidance comes out, that we do as much as we can to understand that guidance and then to use that to help shape any changes in our approach. The guidance that came out from the Colorado Department of Public Health and the Environment last week has been of high interest to us because we do think that it will afford us the opportunity to come up with different approaches, particularly at the secondary level where scheduling has been so challenging. I do just want to name that we believe very strongly that it is important for us to open up safely and to do that in a way that prioritizes the health considerations for our entire community. And Dr. Berman's point about doing the basics well, you know, as we are starting with small groups of students back in person, we are definitely learning a lot about how to ensure that we are changing some of the habits and the practices. It's hard for people to remember things like, don't reach out to shake people's hands when you first see them. You know, we're not going to be doing things like hugging, that even if you have a colleague that you know really well and you're working in a room together, that it's essential that you continue to wear your masks. And so we really want to focus on those basics as we re-enter into our schools and then use that guidance to ensure that we can open up more flexible scheduling for kids. We think it's going to be really helpful, but we want to make sure we've got the basics down.
Thanks. And it looks like we might have lost Dr. Berman, so hopefully we'll get him back.
Yeah.
Oh, no, we just got video. He's still here with us.
Great.
Okay. Our next question is from Jesus. Jesus asks, los hispanos han sido los más afectados por el coronavirus. ¿Qué apoyo le pueden dar a las familias latinas para un regreso seguro a las casas?
Ya, muchísimas gracias por la pregunta. Es muy importante porque sabemos que la mayoría de nuestros alumnos son de raíces hispanas y como ha dicho, el coronavirus les ha afectado lo máximo en nuestra ciudad. Entonces es muy importante. Primeramente queremos asegurarles a las familias, si quieren la opción de clases virtuales, pueden seguir con clases virtuales. Pero también, si quieren regresar a clases presenciales, estamos tomando precauciones para la salud de todos. Vamos a estar usando máscaras, vamos a tomar descansos para lavarnos las manos. Cada escuela tiene lugares en donde se puede poner hand sanitizer. Es muy importante, vamos a seguir las reglas sobre la distancia social. En mi opinión, para las familias que quieren regresar, realmente estamos poniendo las precauciones enfrente de todo, porque sabemos que es muy importante por el desarrollo académico y el desarrollo socioemocional. Para los que quieren estar aquí en las escuelas, queremos asegurar que es algo que les ayuda en mantener un ambiente saludable para todos.
Thanks. And Tini at the Denver Post has a follow-up question. When you say you're considering a different approach because of new guidance, is this for this semester or will it inform next semester?
Yeah, so thank you. Even for our schools that are offering virtual coursework at the high school level, we will have students in our buildings for in-person supports. And we will begin to use this new guidance around how we're offering in-person supports as well. I'm not sure if we have any high schools. We actually have a meeting scheduled later today to go through the guidance with Dr. Berman. And we'll use that information to help share with our school leaders around approaches that we can take for the remainder of second quarter with probably more significant changes starting in second semester.
Thank you. And Russell, also a clarifying follow-up question. On schools facing difficulty reopening, did you say all students and families who choose in-person learning will have the opportunity to receive in-person instruction regardless of what time their homeschool has decided?
So I'm just trying to make sure I followed that question. Can you say again who shared it so I can?
Sure, it's Russell from Channel 7 asking if all students and families who selected the in-person option will have the opportunity to receive in-person instruction regardless of what their home decided.
Yeah, so every school, including high schools that are offering virtual coursework, will have opportunities for students to receive in-person supports. At times that may be an advisory, that may be extensions, that may be college counseling, but all families that have asked for in-person will have the opportunity to have students in their buildings to receive that support. In many cases, their classes will continue to be virtual classes, but they will have the opportunity to be in our buildings for supports.
Thank you. And Melanie from Chalkbeat, another follow-up question here. Is DPS considering making cohorts bigger than 35?
Yeah, thanks, Melanie. So we're having a meeting later today, as I just mentioned, where we're going to go through the guidance a little bit more in depth. And so we'll have more information after that.
Thank you. And I'm sorry, I'm not sure which number this is, whose station they're with. It says, es sabido que en Boulder los jóvenes fueron los causantes del incremento de casos en esa ciudad. En caso de un aumento de casos, ¿cómo DPS va a reaccionar?
So muchísimas gracias. Creo que es Telemundo. Si fijé en el mensaje antes. Déjeme decirlo en español y después le pido información del doctor también para ayudarnos. So, tan pronto que vimos un cambio en los casos de COVID en Denver, la primera cosa que siempre hacemos es poner una cita con Dr. Berman para entender de dónde vienen los casos. So, la semana pasada o hace unos 8 o 10 días, cuando empezamos a ver que los casos estaban incrementando, que estaban subiendo los números, yo hablé con Dr. Berman para pedir información de qué era la causa de esto. Y es cuando nos dijo que habían algunos casos en la Universidad de Denver, en Regis, en el campus de Auraria, y que íbamos a seguir mirando los números, pero que no había razón de cambiar nuestros planes, especialmente como estamos empezando en una manera gradual, nos ayuda en asegurar que todo con el plan sigue bien. So Dr. Berman, this was just a question about, as we look at the numbers going up, how is it that DPS responds in understanding the reason for the numbers going up and how we react to it. And I was just sharing that we immediately reach out to have a conversation with you. And I wondered if you might want to talk just a little bit about how you understand where cases are coming from in your advice to us as we consider reopening.
Sure. I'm sorry that I can't hear everything that you say, Susan. The video, I mean, the audio is still fairly distorted. I think I've caught parts of that and I can read the question. Yes, like in Boulder, the initial increase was clearly due to outbreaks in college students. We've worked closely with the universities involved to introduce better infection control, appropriate testing, isolation, quarantine, and that is working. So we're seeing a decrease in the cases from those universities, as is being seen at the University of Colorado Boulder. But as I mentioned earlier, it's difficult to keep a COVID in one part of the community without any spread to other populations. And so we and others have noticed this, that sooner or later there is some amount of spread to other parts of the community. We're seeing that. We're taking all the actions we can to try to decrease that as well. And a lot of it goes back just to those basics again of masking, avoiding crowds, being outside when possible, hand washing, all those things make the big difference. So I think in the next week or so, we'll be able to tell, are we decreasing overall transmission in the community? So I hope that answers your question. Again, I have difficulty hearing the audio.
Thanks. This next question is from Russell at Denver 7 for both Superintendent Cordova and Dr. Berman. His question is, some elementary schools have already started bringing some of the younger students back to schools. Are you and Dr. Berman encouraged by how schools have accomplished this thus far?
I'm incredibly encouraged at the work that's going on in our elementary schools. And so really it's just been a real pleasure to see kids coming back. I know that many of our teachers have concerns and are nervous about this, but honestly, I can tell you the teachers that I've been able to interact with, both through virtual meetings and through my very limited school visits, what I can tell you is there's just an energy that comes from actually working directly with students that's hard to replicate in a virtual space. I want to really commend our teachers for the work that they're doing virtually, but there's just a lot of real excitement for kids to be able to be with each other and to be with their teachers. New routines for sure, and I think I shared some photos last week of what our classrooms look like in this new environment, but it really has been just a really heartening experience to see the resilience of kids and teachers who are so dedicated to making sure that we're serving our students well.
Yeah, I'll just add that I'm also very happy that DPS has been able to bring back students in the youngest age groups. Those are the groups we think that benefit in particular from in-person learning. So to have that group that we think needs that so much be able to get back into the classroom is of high priority for us. And so we're very excited to see that moving forward. We look forward to continuing to work with DPS to make sure those are safe opportunities for in-person learning.
Okay, I think that's it. Thank you everyone as always for being here. And as always, this is recorded and you can find that on our website.
Thanks everyone, see you next week.